We are back on MorningLine. Thanks for joining us on this Wednesday. We're talking about Medicaid expansion, the possibility of that maybe coming to the state of Tennessee, since we haven't, over the last 4 years, agreed to take the millions and millions of dollars from the federal government. Michele Johnson with us from the Tennessee Justice Center. Mary Linder Salter is with us. Is it
Tatis?
Tatis, Tennessee Association of Alcohol, Drug, and Other Addiction Services. You know, at the beginning of the show, I misspoke and said Medicare expansion. We're talking about Medicaid expansion, but you were telling me, too, during the break, that actually Medicare, which is for seniors, does not cover addiction services, does it?
So it does not. It covers detox only, medical detox in a hospital, and some outpatient care that's generalist, but no rehab, no residential treatment, no intensive outpatient treatment services.
Would any of those seniors benefit then from Medicaid expansion?
They could if they're duly eligible, yes.
Okay, so that would be a possibility.
If they meet the poverty threshold, and many of them are eligible for dual coverage plans, so that would significantly address it, yes.
Yeah, and it's interesting, though, you're right. I mean, I'm sure there's seniors with pain and stuff like this that are on some of these opioids, and then, you know, that's often how you just get hooked. When you start off with a medical condition, you really need it, and then things get out of control. All right, so I thought we would just touch bases a little bit more on the whole concept of how these hospitals are closing. You said a number. How many hospitals are closed?
So 8 have already closed. There's about 30 that are at risk.
And these are where? I mean, they're not closing here in Nashville, all right? So where are they closing?
Well, they're in rural Tennessee.
Okay.
So the risk is that we're really going to gut the rural communities.
Which means the people out there will not have any place nearby to go, and they're going to have to commute to one of the bigger cities to get here, if they can get here. Right.
Also, worse than that is that it means that mostly in these communities, they're the #1 employers, and there are businesses that rely on them being a #1 employer. So small businesses, you know, the people who do the laundry for the hospitals and the restaurants around.
Right.
So when McNairy County Hospital closed, you know, we went there and interviewed nurses. And their families had been there for generations. They don't have another place to work in McNairy County, and the restaurants.
Did they close?
Well, they closed because
how did it translate?
Yeah, the funding for the Affordable Care Act was such that everybody was going to be covered, and so hospitals gave back money because they knew it was in their financial interest to make sure every American was covered. And then the Supreme Court came along and said, wait, governors should decide whether or not everyone is covered. So what it's created is a population of people who are very, very poor who are covered, and then a population of folks who are bordering on middle class to upper class who get subsidies through the Affordable Care Act. But there's a gap in the middle, and that's these low-wage workers who, you know, basically who are going without care, or if they get care, they're in the emergency room. And of course, if they're at risk of loss of life or limb, the hospital takes them in. And that's the cost that is being passed on to us. And that's the cost, this uncompensated care cost that is closing the hospitals, because the hospitals weren't supposed to have uncompensated care. And so in states that did expand, their uncompensated care numbers have flatlined. And in our state, they just keep growing and growing. So it's the worst way to get care. It's an expensive way to get it. And it means that we're losing jobs every day in our state. In places where they're already losing jobs.
What happened in McNairy County when it closed?
Well, basically,
I've not been out there,
I mean, basically, it was a huge loss of jobs. There were people who had to move, you know, to Memphis to find work. And if you happen to be driving through there, apart from whether you live there, if you happen to be driving through there and have a car crash, you might not make it to the next hospital.
I was going to say.
So, you know, that's really. There are more hospitals than we need in our state. We all know there are probably more hospitals than we need, but the way that this is happening, the kind of random way that hospitals are closing, is very damaging for rural Tennessee. And it's damaging because they need those jobs. And they have jobs that are not just nurses and doctors, but the cleaners and, you know, the cooks and all of these different jobs. There aren't any other industries going to many of these rural communities. And once one hospital closes, it's a domino effect for other rural hospitals. So in West Tennessee, we've lost 4 hospitals. One of their legislators is the one who voted against us. And so, you know, that's, you know, your question of like, when do we get to a point where we're going to actually govern and have sound policy? And that's, I think, while we're grateful for you to helping us spread the word, because I think making sure Tennesseans understand it and are talking to their leaders. This is what we want.
Absolutely. I mean, I would have thought that as some of the hospitals closed, it creates a domino effect because they're all affected by the same elements that are causing one to close. But wouldn't that mean that the other hospitals are getting those other patients? But how's it the domino effect that kicks in?
Well, the uncompensated care numbers then are pushed on to the next closest
just the next,
hospital.
and it's still going to be and then they're going to take the hit. I see what you're saying on this. How many more are at risk right now? How many
over
are on the
30, according to the Hospital
30.
Association, over 30 hospitals are at risk. And you know, the fact is that all of those hospitals are generating income for our state, and they're providing essential jobs. Apart from the fact that you kind of want a hospital to be there if you have a car accident or a stroke or a heart attack.
Right. Well, I was trying to look at some of the other things. Obviously, rising health premiums for all, rural hospitals closing in Tennessee. What's this now? Prohibiting uninsured Tennesseans from working full time because they can't get treatment. What do you mean by that?
Yeah. Well, I mean,
because you're sick and you can't work full time.
Yeah, I guess I don't understand the question. Sorry.
I just it's one of those some of the organizational leaders pushing for expansion. What the impact would be of having it would mean it would allow more Tennesseans to go back to work. I assume it just means that it's going to get them. Yeah.
A lot of these folks are in jobs that they're construction workers or they do really hard labor. So they get to be about 50 and they're injured, but they can't get that injury fixed. So as soon as they can get insurance, they're back to work. You know. So we have this amazing, amazing client, Kenneth Wilburn from Bledsoe County. He's worked since he's 16 years old, but he has an injury. And he desperately wants to get back to work, but he can't afford the surgery on his shoulder, so he can get back to work. So he's going without health insurance. He's also going without any sort of means to support his family after working his entire life. It makes no sense.
Yeah, it's just thousands of Tennesseans. It just I don't know if it resonates with those who are lucky enough to have health insurance. What would it be like not to be able to access this?
Well, there is a nationwide poll that has asked people, you know, of people who haven't accessed care, what prevents you, you know, from going to treatment? And the number one reason is access to health insurance. They do not have the ability to pay. They don't have a coverage for whatever reason. And so there are people out there who are languishing for a lot of reasons because they can't figure out how to financially make it work. And so that just, you know, frankly increases the likelihood of intergenerational addiction and other kinds of issues as well.
I'm just guessing the majority of the folks who are addicted can't pay.
Correct. True? They certainly couldn't pay on their own. Yes.
All right, they can't pay on their own, right? So they're going to need help. So, and then the question is, where do you draw the line? Does everyone get treatment? If there are zillions of addicts, are we going to be able to afford to pay for them all? I'm just wondering, where do you draw the line? Where would you? You want to treat everyone, don't you?
I would love to treat everyone. Yeah. I think it's an interesting question, and I draw the comparison all the time that, you know, addiction is a chronic relapsing disease, much like diabetes, hypertension, asthma, and many of those other diseases, and they are care managed, and they're managed as a long-term chronic condition. We treat addiction like it's an acute episode. Go get better, get those substances out of your system, and bye. And unfortunately, we know that they need chronic care management. So the relapses, those things can be mitigated when people get appropriate long-term care. But we don't manage it that way. We know that it has a chronic component to it, but, and I say we, I'm generalizing, but if you have insurance, you certainly get much more access to long-term management, and you don't get it if you are not accessing benefits like that, or if you are uninsured or marginally insured.
Gotcha. Go ahead.
Yeah, I was going to say, what you look at in states that have expanded is that the opioid addiction is not as severe. And so what that says to me, as somebody who's represented people who are uninsured for 24 years, is you have people who, if they were able to access medical care, their pain would be less, so they wouldn't become addicted to opioids. You know, their care would be managed in a way, you know, their physical conditions would be managed in a way that was healthy, as opposed to them having to self-medicate. Also for people with depression, if they aren't insured and they can't access the treatment, you're basically stopping people from becoming addicted to opioids. You're preventing it by giving them health insurance that actually treats what's ailing them, as opposed to making them treat themselves, which is where we have this growing number of folks addicted.
And I'll add to that, because I think Michelle's right. It is a preventative thing, but it's also something that prevents relapses. If somebody's become addicted because of a pain management issue, if the pain is not treated as part of their addiction treatment in a coordinated care fashion, then they're just going to relapse, because the pain is unbearable or unmanageable. And that same is true for depression or many of the other physical ailments that lead people to take opioids. So yeah, it's a prevention, but it's also part of chronic care.
I gotcha. Listen, let's take a break. When we come back, I see we've got Joe on the line. We'll get to you, Joe, and some other calls as soon as we come back from this break. We continue to talk about the idea of Medicaid expansion. If you're against it, I want to know why. I don't get it. We'll take a break. Be back with more right after this.